Navy Team New London. Today is Friday, February 19th, and community trends are looking better since I spoke with you last. As trends head in the right direction, however, and vaccinations increase, it's still no time to relent or become complacent. And that's what I'd like to highlight in this latest message to keep you informed and aware of Navy and SUBASE New London efforts against COVID-19. A pandemic is like two races, a sprint by the disease to spread, grow, and develop a variant, and a marathon by us to mitigate the spread, advance courses of treatment and vaccines, and defeat the disease. From the late fall of 2020 until about 2 weeks ago, the sprint by COVID-19 through a second wave and surge was setting records in infection rates, hospitalizations, and deaths. Recently across the nation, COVID-19 cases are now trending down from the most recent peak in January. As of yesterday, February 18th, U.S. cases totaled over 27 million, but with a 2-week decreasing infection rate of minus 44%. U.S. deaths have totaled over 490,000. Connecticut has seen a trend similar to that nationwide over the past few weeks, with the positive test rate dropping to less than 2.5%. And in fact, recently we saw an impressive 1.5% test rate this last Wednesday, the lowest daily rate since mid-October. Trends have so improved that Connecticut Governor Ned Lamont announced this week that he would consider loosening event restrictions if COVID-19 numbers continue to decline across the state. The governor is eyeing the possibility of easing measures in March to allow 50% capacity for indoor events with a limit of 100 people and a limit of 200 people for outdoor events. Here at SUBASE, we will continue to monitor the trends. If we reach milestones that allow us to seek relaxation to force health protection condition Bravo measures and the widening or reopening of some services and activities, I will keep you informed. Certainly the focus on continuing to observe virus mitigation measures as well as the opportunity to be vaccinated has influenced trends in the right direction. As you may know from our recent series of virtual town halls about the vaccine here at SUBASE, members of Navy Team New London, including me, have already begun to receive the vaccine, and a good number have received their second dose. Our clinic is following the detailed DoD distribution plan. The vaccinations of healthcare providers and emergency service personnel, as well as those preparing for deployment and those personnel providing support to deploying forces, have almost been completed. We've begun to vaccinate our frontline essential workers and been able to support some vaccinations for our 75 years and older population. The clinic has reached out to established patrons within their system who are 75 and older and provided a good number of vaccinations in that crowd. If there is a patron of our SUBASE clinic who may have missed that contact, I encourage you to call the clinic at 860-694-4811 to explore options. Patrons 75 and older may also call the TRICARE appointment line, 888-628-9633, to schedule a vaccine. The representatives there will take your information and pass it to the clinic COVID-19 immunization team. Again, this is for established patrons within the clinic system. With vaccinations, we as a base, state, Navy, and nation move inch by inch closer to community immunity. But until that time, all of us at SUBASE have a responsibility to keep others safe and to protect our Navy family, and our no-fail missions. To do so, we have to continue to take these three straightforward steps. First, we must continue to abide by restrictions against large gatherings or unnecessary exposure. Second, we must conduct ourselves as if we and everyone around us has the virus. For those of us on SUBASE, and by order of the Secretary of Defense, that means wearing our facial coverings at all times when not in a closed office by ourselves, eating or when asked to identify ourselves by security forces. And third, we can voluntarily take the COVID-19 vaccine when offered. Now, one quick note for those who have taken their second vaccine doses and are immunized. News reports and Dr. Fauci recently noted the data is coming in, but it remains too soon to tell if vaccinated people can still transmit the virus as an asymptomatic infection. So stick to those active health protection measures and continue to employ them. If you're active duty, reread your page 13 orders, as I did just the other day, and talk to your supervisor to ensure that you understand them. So to sum it up, we have some good news, but please do not let current news cloud your memories of the recent bad news, statistics, and trends. Keep vigilant. Protect your health, your families, mine, and the health of all our sailors and civilians carrying out the critical missions of this installation. The marathon to end this pandemic continues, and there is a finish line. So stay the course and stay healthy out there.